Okay, so let's start. So we're here with Minister Holland, Federal Minister of Health, and Laksha Keshan, owner of Smile Lab. And we're just here to do a brief interview and just talking about some very cool and exciting things happening in the dental care space. So Mr. Holland, maybe I'll start with you. Can you maybe just give us the elevator pitch on what the Canada Dental Care Program is?
Yeah, you bet. I mean, so you would see this. There's so many people in our community and all across the country who can't access care. They don't get their oral health taken care of because they don't have the money to do it. And it means that other priorities like paying for rent and groceries understandably come first. And that is just horrible because what ends up happening, as you are better to explain than I can, is, I just got my teeth cleaned today, right? And there's buildup there, and that's going to mean problems, not just for my oral health, but potentially for my cardiovascular health, potentially for the rest of my body. This is a really important tool of prevention. And so when we get people seen and we get people having a healthy smile and a healthy mouth, then that means they're much, much less likely to have chronic disease and illness and wind up in a hospital sick, gumming up our system. So, it is not just a matter of social justice that everybody deserves a smile they can be proud of. It really also is fundamentally about prevention.
Perfect. And I just want to zone in on one thing, which I think sometimes people just want to really understand how is it more affordable? So maybe just the process of, how this translates into affordability.
Yeah, that's a great point. Look, I don't care where you are on the planet. Yep. Things are more expensive for everybody. And, as a government, you can make excuses for it or you can try to find solutions. And so we've been in the solutions mode of saying, what are some of the things that are really important to people that they're not doing, that they need to do for their health and well-being? And dental care is one of them. We have 9 million Canadians who don't have access to insurance. That means that, these things can be very expensive, as you know, particularly for people who've never seen a dentist or a hygienist. They're coming in and seeing you or others with very serious problems that haven't been addressed. And what happens is that's too expensive. I talked to a lady, she found out her mother was too embarrassed to come and tell the family she didn't have enough money. So she had problems with teeth. She didn't have money to get them fixed. She just kept getting them pulled, right? Tooth after tooth after tooth. She barely has any teeth left in her mouth. And that was something that was preventable that didn't need to happen, right? But she didn't have the money to deal with it. And that shouldn't be happening in a country like Canada. And so this plan for people who have under $70,000 a year and under, what we've said is that, here's the amount the government will pay. And there's no copay. There still can be balanced billing because depending on where you are and, there could still be an additional fee, but it's a very small fee, right? It's this very small fee that they pay to make sure that it's affordable. And that's what we're all about, making sure that people have access to care that they can afford.
Perfect. And I guess on a more exciting note, what for you personally, what is has been the most exciting part about rolling out this program?
The biggest thing for me is just the joy I get. Somebody will stop me and say, a senior stopping me and saying, like, I got this care and I just feel seen and I just feel so excited. For me, seeing people get that care, it's some of the most powerful work that I've ever had an opportunity to do in my life. And I just feel so grateful every day to see more and more people get care. 780,000 people at this point have been seen by this program in just 5 months. And we have so many more to get to, but it's pretty powerful to see those people who are getting care.
And how do you see clinics like Smile Lab participating and kind of contributing to this vision?
Yeah, I think, so Smile Lab, I went and we just cleaned my teeth, which was great. I was overdue. And this is so important because it's important for people to know you can see a hygienist, right? You can see a dentist. You have different options in your community and you should explore that. And the dental care plan gives you the ability to do that. And Smile Lab is, just a phenomenal place that's got the care of patients put first. And, it's one of the things that I think has also been a tremendous pleasure for me is to talk to oral health professionals, whether or not it's hygienists or dentists or denturists, who are so passionate about their clients and so passionate about public health and, doing so many great things in their community. And this program expands that. This program gives you the opportunity to touch so many more lives and bring care to so many more people. You connect them not just to their oral health, but it opens up conversations about their health overall. Does that conversation save my life? Right. And, these are the things you get to do. That's what Smile Lab is doing. you're providing care, you're connecting people to the care they need and to the solutions they need to take care of themselves and their families.
And then, Laksha, maybe to you, you being actually the venue that, or one of the venues where these programs actually then come to life and we see the benefits of. Why is it important for you that dental care is accessible? But I think you've actually done more of a job of making it more fun too, right?
Yeah, I try my best to make it fun, make it more enjoyable because let's be real, not a lot of people like going to the dentist. It's not a common thing that people are excited for. So I try to make my space more relaxing and more enjoyable so that when they come in, they're actually looking forward to it, not just another appointment, but something more fun and exciting and not so anxious.
And how have you, we see a lot of young people actually coming to your clinic. How have you utilized kind of social media to promote both the program but also Smile Lab's mission as well?
Yeah, social media has been great. I use Instagram mainly, and I'm able to promote what's happening at Smile Lab, new things that are coming up, like the CDCP plan. I'm able to educate more. I'm actually able to learn a lot from other people that are communicating with me in real time, right? So it's a good way to expand out there.
And just going back to kind of, I guess, the core purpose of this program is to really help those in need. Like, why is it important for you to help those in need?
I think helping those in need is super important because, dental care is like something that's looked like bypassed, right? Like people think it's something that's not a big deal, like overall health. So it's important for me because, again, it doesn't just help with your oral health. It helps with boosting your confidence and your overall health.
Big time.
Yeah.
And I recently heard that you are actually starting, it's not news to you as well. She's actually starting a satellite clinic. Do you want to talk about the satellite clinic and who is partnering?
Yes, I am partnering up with SAC, an autistic center, and it's going to be a little clinic that they are allowing me to use their space. And I'm going to make it more comfortable for those on the spectrum to come in and have their cleanings done. So they don't get anxious going to an actual dental office.
That's fantastic. Yeah, that's really special.
Yeah.
I mean, I think that's one of the things we're looking for in this plan. It's not enough just to give coverage. There's a lot of folks who have needs that are different than other folks, and making sure that we get access, to care for everybody. I'm so glad you're doing that. We also have the Oral Health Access Fund. That's going to be part of what we're doing, where we're working with folks like you and others. We're going to see all kinds of projects funded to get at many of those situations: rural, remote, persons with disabilities, people living with autism, people with different challenges, to make sure that everybody gets care, right?
Yeah.
Because that's really where we're going to succeed. I mean, I think one of the things we have to do as a society is move out of being a crisis-based system in our health system, where we're dealing with things after they become a terrible problem, and there's so little we can do, and they're really in a state of crisis, and that costs us so much money, to being a prevention-based society where we're keeping people healthy and avoiding problems. We know 70% of chronic disease and illness can be prevented, and that's really what we need to be doing. And I think that's one of the big pushes of this plan overall.
Yeah, dental hygiene is like a preventative measure, right? So we're trying to stop you from getting those cavities and having to get those fillings, because those are the things that obviously people can't afford, and because they're much more expensive than an oral hygiene cleaning. So if you can just get yourself into the doors to get that preventative measure done, then you don't have to keep coming back.
Yeah, and worse, this could lead to all kinds of chronic diseases and illness as well. I mean, so a lot of times people think about losing their teeth or fillings or cavities, but it's a journey that leads to even worse places. We know its impact. I used to be with heart and stroke, huge impact on cardiovascular disease, right? So there's many different ways in which, if you don't take care of your oral health, it could be very disastrous for your overall health.
Yeah,
that's great. And I guess my last question is for both of you, both as one of the people that has led the charge on legislating a path forward for more accessible dental care, and Laksha, as you, as someone who is delivering that primary service. What would you say as a final word of what you think the future of dental care in this country looks like?
Well, for me, it's exactly what you're seeing here at Smile Lab, right? Which is innovation, coming and delivering care in a different way, making it more fun, making it more accessible, making sure that everybody can afford it. getting to different populations that have difficulty with access to care. And I really think that, and I say this, I was meeting with the dental associations. I'm going to be going to the Hygienist National Conference in Niagara in 2 weeks. I think that this is an opportunity in oral health for oral health professionals who already are champions of public health to really take a front stage in our communities in advocating, because as you're sitting, you and I are having that conversation about how I got to be doing, how I got to be flossing a little differently, and and some of the things that I've got to be doing a better job of. It's having that conversation about my blood pressure. It just is the relationship that you develop with your oral health professional becomes really important to your overall health. And I think it's a part of an expanded view of primary care, where all of these different elements of care are working in tandem to one another. And so I really see us moving oral health more into an integrated view of overall health and stop seeing these things as two independent things, which they are not.
Yeah. No, I totally agree with that. I just find that there's more need and people are actually noticing the need for oral health, and there's a lot more people advocating for it. And that I feel is going to eventually bridge the gap for oral care and provide care for everyone.
That's what we want, for sure.
Perfect. Well, folks, thank you for coming to Smile Lab, Minister Holland, and getting your teeth cleaned, but as well as sticking around to share some great knowledge and facts. And Laksha, great job. And thanks for hosting us.
Yeah.
Thanks,
Thank you.
Laksha.
Thank
Really
you. Thank
appreciate
you
it.
so
Thanks
much.
so much. Thanks so much. Really appreciate it.